Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a physician talking to a patient called Mrs. Lawson. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Mrs. Lawson. I'm Dr. Fields, a specialist in vascular medicine. How are you feeling today?
Hi, Dr. Fields. I'm not feeling great, to be honest. My leg has been really bothering me.
I understand. I've reviewed the notes from your GP, and it looks like you've been dealing with pain and swelling in your left leg. Could you tell me more about when these symptoms started?
Sure. It started about a week ago. At first, I thought it was just a muscle strain, but then my calf started to swell and the pain got worse, especially when I walk or stand for too long.
I see. Do you recall any recent injuries to your leg, or have you been immobile for an extended period, like after a long flight or being bedridden?
No injuries, but I did have a long flight about 2 weeks ago. I was sitting for almost 12 hours, and since then I've noticed this pain.
That's helpful to know. Based on your symptoms and the timing after a long flight, I'm concerned that you may have developed deep vein thrombosis, or DVT for short. It's a condition where a blood clot forms in a deep vein, usually in the legs. Have you heard of this before?
I've heard of blood clots, but didn't realize they could be related to travel. How serious is this?
It can be serious, and that's why it's important to diagnose and treat it early. DVT can cause pain and swelling as the clot obstructs blood flow in the vein. The major concern, though, is that part of the clot could break off and travel to your lungs, which would cause a pulmonary embolism. That's a medical emergency, so we want to make sure we address this as soon as possible.
That sounds scary. How do we find out if I really have DVT?
We'll start by performing a Doppler ultrasound of your leg. This is a non-invasive test that uses sound waves to create images of the blood flow in your veins. It will allow us to see if there's a clot and where it's located. If needed, we might also order a D-dimer blood test to check for elevated clotting factors in your blood.
Okay, and if it's confirmed, what's the treatment?
The standard treatment for DVT is anticoagulant medication, commonly referred to as blood thinners. Medications like heparin or warfarin help prevent the clot from growing and reduce the risk of new clots forming. Treatment typically lasts for 3 to 6 months, but it can vary depending on your situation.
Blood thinners sound dangerous. What if I start bleeding a lot?
That's a valid concern. Blood thinners do increase the risk of bleeding, but we carefully monitor the dosage to balance the benefits of preventing clot growth with minimizing bleeding risk. We'll provide you with guidelines on how to manage any side effects, and we'll check in regularly to make sure the medication is working properly.
Are there any other options besides blood thinners?
In some cases, if the clot is large or causing severe symptoms, we may consider other treatments like thrombolysis, which involves breaking up the clot with medication delivered directly to the affected vein. However, this is usually reserved for more severe cases. For most people, blood thinners are highly effective.
That's good to know. So, What happens if the clot doesn't go away with treatment?
The clot may not dissolve completely, but the body often absorbs it over time, and the medications help to reduce its size and prevent complications. It's also important to manage risk factors to avoid future clots, staying active, moving around during long periods of sitting or travel. And wearing compression stockings can help improve blood flow in your legs and prevent DVT from recurring.
I'll definitely keep that in mind for future flights. Is there anything else I should do in the meantime?
Yes. In addition to the ultrasound, I recommend that you avoid long periods of inactivity while we await the results. Try to keep moving regularly, even if it's just walking around the house. Also, elevate your leg when resting to reduce the swelling. If you notice any sudden chest pain, shortness of breath, or rapid heart rate, seek emergency care immediately, as these could be signs of a pulmonary embolism.
Got it. I'll make sure to keep an eye on that.
Good. Once we have the ultrasound results, we'll be able to confirm the diagnosis and start treatment right away. With proper care, most cases of DVT are manageable, and we'll work together to reduce your risk of future clots.
Extract 2, questions 13 to 24. You hear a GP talking to a patient named Mr. Jacobs. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes. Hello there. Please come in and have a seat. You must be Mr. Jacobs.
Yes, that's me. Thanks for seeing me on short notice. I've been worried about something that happened over the weekend.
Of course, I'm here to help. I understand you had a bit of a scare in the heat. Could you tell me what happened?
Sure. So, it was a really hot day, and I was out running. After about an hour, I started feeling lightheaded and exhausted, like way more than usual. My skin felt burning hot, but I couldn't sweat anymore. I felt nauseous and even had trouble focusing, and honestly, it really shook me up.
It sounds like you may have experienced a form of heat illness, possibly even heat stroke. Heat stroke can be quite serious, especially with prolonged exposure to high temperatures and physical exertion. Let's discuss the symptoms you noticed and how it unfolded. Did you end up fainting or experiencing confusion?
I came close to fainting. I remember feeling really dizzy and disoriented. I had to sit down right away, and even then, I wasn't sure I could stand up again. My wife eventually drove me home, and I spent the rest of the day indoors drinking water and cooling off.
That sounds quite concerning. Heat stroke happens when the body overheats, and it loses its ability to cool down through sweating. Since you're an active person, you might already know that intense exercise, especially outdoors in the heat, increases your risk. How are you feeling now?
I'm still a bit tired and lightheaded, to be honest. I've been drinking a lot of water since, but I'm worried because I still feel a bit off.
The symptoms can sometimes linger as your body recovers, especially if you were severely dehydrated. Given what you've described, it sounds like you took some important first steps by cooling down and rehydrating. But let's walk through some strategies to prevent this in the future and get a sense of whether any additional recovery steps might be needed. Have you been keeping up with fluids and electrolytes?
Yes, I've been drinking water regularly, but I wonder if water alone is enough, especially during exercise.
Good question. When you're active in high temperatures, your body loses not only water, but also essential electrolytes like sodium and potassium. When these are depleted, rehydrating with water alone sometimes isn't enough. In cases of heat stroke, electrolyte replacement is key. There are various drinks and supplements to help with this, things like sports drinks or electrolyte tablets.
So, it's not just about staying hydrated. I should also be thinking about these other things, like salt.
Exactly. In fact, one of the early signs of heat exhaustion, or heat stroke, is when the body stops sweating because it's run out of fluid and salt. Electrolytes help maintain balance in your body and ensure your muscles and nerves function properly, especially under strain. How often do you tend to exercise outdoors?
I usually run a few times a week, but when it's hot, I sometimes end up running at midday, which is probably the worst time, right?
Yes, that's correct. The sun is at its peak, and temperatures are highest around midday. When possible, try running early in the morning or later in the evening to avoid the intense midday heat. And consider slowing down your pace on particularly hot days. Your body will thank you for it.
I see. I usually just push through because I don't want to skip a workout, but I'll definitely be more careful now. Is there anything else I should look out for?
Yes. It's important to be aware of the early symptoms, like dizziness, muscle cramps, headache, and nausea. These can be signs of heat exhaustion, which, if untreated, may progress to heat stroke. At that stage, confusion, lack of sweating, and even unconsciousness can occur, making it a medical emergency.
So if I start to feel any of those early symptoms, I should probably take it seriously and stop right away.
Absolutely. The key is to act at the first sign of discomfort. Find shade, cool down with water if possible, and rehydrate with an electrolyte drink. If symptoms don't improve quickly, or if they get worse, it's best to seek immediate medical help.
That makes sense. I think I just didn't realize how quickly the heat could affect me.
It can indeed happen fast, especially when combining high temperatures with physical activity. Heat stroke doesn't discriminate, and it can happen to anyone in the right conditions. Let's also talk about keeping your head and neck covered with a hat and wearing light, breathable clothing. These can help reduce the risk significantly.
Those are good tips. I'll definitely be more mindful about when and how I run in the future. Do you think there's any lingering risk now that I've had this scare?
Given that it's only been a couple of days, I would recommend taking it easy for the next week. Make sure to stay hydrated, rest, and consider slowly reintroducing physical activity, perhaps indoors, until you feel fully recovered. That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a tutor lecturing the students. Now read the question.
Let's have a quick chat about the diagnosis for Michael, the patient in Ward 5 with recurring headaches.
Yes, I was a bit unsure because it's a recurring headache, so it's not going to be something like intracranial pressure, right?
Well, it's possible, but he doesn't have other neurological symptoms, so yeah, it's unlikely. What else could it be? Something more common that causes headaches?
Unilateral headache pain. It's like throbbing on one side.
Right, but think about something very much more common.
Maybe migraines.
Close, but think simpler.
Maybe just tension headaches.
Right, yeah. Tension headaches.
Now look at question 26. You hear a medical intern asking his senior colleague about an unusual foreign body case report involving a fish jaw in an eye. Now read the question.
With fishing hooks.
Yes, it's rare but not unheard of. Some fish have spines or bones that can puncture unexpectedly if someone is close enough during handling. In this case, the injury was reported to be accidental. And it's similar to the earring incident we read about, where a patient inhaled an earring back while talking. We document these in case reports to highlight uncommon injuries and unusual presentations so others know how to handle similar incidents.
That makes sense. Definitely worth knowing.
Now look at question 27. You hear a neurologist having conversation with a radiologist. Now read the question.
This patient was admitted following a suspected stroke. The MRI confirms a clot in the middle cerebral artery. We need to decide on immediate treatment.
Yes, I saw the imaging results. The clot is significant, but there doesn't appear to be any major hemorrhage. We've also ordered blood work, and those results should be available shortly. Regardless, I think we should hold off on aggressive treatment for the next 24 hours to monitor for any potential complications.
I understand your caution, but with this kind of blockage, time is critical. If the blood work shows no contraindications, I think we should proceed with thrombolysis or even consider thrombectomy as soon as possible.
I agree that time is important, but we need to be cautious about reperfusion injury, especially if there's damage not visible in the initial scans. I recommend waiting for the lab results before making any decisions on intervention. Now look at question 28. You hear a neurologist talking to a trainee about a patient's unusual sensory experience. Now read the question.
Have we got Mr. Lang's history notes?
Yes, they're right here. He is coming in today because of his synesthesia linked to his chronic migraine.
Well, we'll see what he reports today, but from the look of the past assessments, his sensory symptoms seem stable, so we may not need to alter his treatment for now. However, if his sensations have become more intense, we might need to reassess.
So, what exactly triggers this?
We understand that it involves cross-wiring in sensory pathways, causing mixed sensory perceptions like tasting metallic flavors when a migraine starts. But why it occurs only in certain conditions, like his migraines, isn't entirely clear. There's some speculation about genetic predispositions, but research is still ongoing, I'm afraid.
Now look at question 29. You hear a GP discuss a patient with a rheumatologist. Now read the question.
Hey, Dr. Green, I have a patient here I'm considering for a possible joint replacement surgery.
Yes, I reviewed the file. Is this the 72-year-old woman with severe osteoarthritis in her knees?
Exactly. She's been experiencing joint pain for over a year, and it's been getting progressively worse. The pain limits her mobility significantly, especially after walking or any prolonged standing. The patient reports little to no relief from the full range of analgesics, including both NSAIDs and stronger pain medications. The latest examination shows extensive joint damage, and the patient feels that her quality of life has been impacted. I think it might be time to explore surgical options.
I agree, given her limited response to medications and worsening functional limitations. If there had been some improvement with her current management, we might not be here, but as it stands.
Now look at question 30. You hear a gynecologist talking about opening and managing her own women's health clinic. Now read the question.
was a vision I had from the beginning of my career. I wanted to create a safe, supportive space dedicated to women's health needs, where I could foster strong, trusting relationships with my patients and make a meaningful difference in their lives. Opening the clinic involved many hurdles, from recruiting specialized staff to designing a comfortable clinic environment and, of course, building a patient base. While all these tasks were challenging, I quickly realized that managing the financial side is by far the most demanding. It's a delicate balance, spending the necessary time with each patient to address their health concerns while still ensuring that the clinic sees enough patients to remain financially sustainable. Right now, I'm even considering partnering with another practitioner to share the costs and workload. But financial stability is definitely the most complex aspect of running this clinic.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear an interview with Dr. Rennie Singh. You now have 90 seconds to read questions.
Hello, Dr. Rennie Singh. Dr. Singh is a consultant pharmacist and associate lecturer at the University of Southgate, specializing in medication management in healthcare. We're pleased to have you with us today to discuss the importance of medication management. Let's start with why this has become such a critical topic in healthcare.
Thank you, James. I am delighted to be here. Medication management has gained much attention in recent years because of its role in promoting patient safety. While medications have become more sophisticated and targeted, the potential for adverse effects remains a significant concern. For many patients, especially those with chronic conditions, managing medications can be complex. In fact, studies show that as many as 50% of patients do not take their medications as prescribed, which can have serious implications for their health outcomes.
That's an alarming statistic. Can you share what some of the primary challenges are when it comes to medication adherence?
Absolutely. There are a few key challenges. First, there's the issue of polypharmacy. This is common in patients with multiple conditions who may be prescribed several medications. Remembering the dosage and timing for each medication can be overwhelming. Side effects also pose a challenge. For instance, if a patient experiences nausea or dizziness as a side effect, they may stop taking the medication altogether without consulting their healthcare provider.
So, what measures are being taken to help patients adhere to their prescribed medications?
Healthcare providers are increasingly using patient-centered strategies. This includes educating patients about the importance of their medication regimen and addressing potential barriers. Tools like medication calendars, pill organizers, and reminder apps have also become common. In addition, there's a shift towards simplifying regimens wherever possible, such as prescribing medications that can be taken once daily instead of multiple times.
You mentioned side effects as a barrier to adherence. How can patients be supported in managing these?
Managing side effects is crucial for ensuring adherence. One effective approach is setting up a follow-up schedule, either in person or virtually, where patients can discuss any concerns with their provider. This allows for potential adjustments in the treatment plan, whether it's reducing the dose, switching to an alternative medication, or adding a supportive medication to counteract the side effects. Empowering patients to communicate openly about side effects is key to finding solutions that work for them.
That makes a lot of sense. What role does technology play in helping people manage their medications?
Technology plays an increasingly prominent role. There are now numerous apps and devices specifically designed for medication management. Some apps provide reminders and track adherence, while others allow patients to note any symptoms or side effects they experience. For patients who may not be as comfortable with technology, simple text reminders can still be very effective. The important thing is to choose a system that fits the patient's lifestyle and comfort level.
How do you see the future of medication management evolving?
In the future, I believe we will see an even more personalized approach to medication management, where treatment plans are tailored based on individual patient data. With advancements in pharmacogenomics, we will be able to predict how a person will respond to certain medications, which could reduce side effects and improve adherence. Additionally, as digital health tools advance, we will likely see more integrated systems where medication data can be shared across platforms for seamless communication between patients and providers.
I see we have a few audience questions.
Extract 2. Questions 37 to 42. You hear a radiologist discussing the latest technological innovations. Now, read the questions. You now have 90 seconds to read questions. Thank you all for having me. My name is Dr. Kelly Preston, and today I am excited to discuss the latest technological innovations in radiology and what they mean for the future of our field. Radiology is undergoing significant changes, largely fueled by advancements in imaging technology, artificial intelligence, and new, more personalized approaches to patient care. One of the main drivers behind these changes is the shift toward real-time imaging. Patients, clinicians, and medical researchers now expect quicker and more accessible results, which demand improvements in imaging speed and quality. To meet these needs, the development of high-resolution, low-dose imaging technology has been prioritized. These advancements allow radiologists to produce detailed images faster and with less risk to patients. For instance, certain advanced MRI scanners can now provide high-resolution images in a fraction of the time it used to take.
This not only benefits patients by reducing their time in the scanner, but also increases the radiology department's efficiency. Another major trend is artificial intelligence, or AI, which has already begun transforming our daily operations. One of the areas where AI is having the most impact is in the early detection of diseases. For example, AI algorithms have been developed to analyze mammograms and can identify abnormalities more accurately than the human eye. Sometimes years before symptoms even appear. This early detection capability is life-saving, especially for conditions like breast cancer, where early intervention can make a significant difference in outcomes. Beyond diagnostics, AI is also helping to optimize imaging protocols. Algorithms are now able to determine the best sequences for MRI scans based on a patient's specific characteristics, which helps streamline the scanning process. A similar application of technology that's creating a buzz in the radiology field is the concept of radiomics. Radiomics involves extracting a large number of features from medical images using data characterization algorithms. Essentially, this technique allows us to analyze and quantify data that might not be visually observable, giving us deeper insights into the underlying biology of a disease. Radiomics can, for example, help differentiate between aggressive and non-aggressive types of tumors, guiding treatment planning in a more personalized manner. The next major development I want to discuss is the expansion of interventional radiology. Historically, radiology focused primarily on diagnostics, but interventional radiology, or IR, is now at the forefront of offering minimally invasive treatment options. These procedures use imaging guidance to perform treatments, such as biopsies, ablations, and vascular procedures, without needing large surgical incisions. A growing number of hospitals are developing dedicated IR departments, staffed with specialists trained in these procedures. What's driving this growth? Patients and clinicians alike see the benefit in treatment approaches that reduce recovery time, infection risk, and hospital stays, and IR delivers on all fronts. Of course, with all these advancements come challenges, particularly when it comes to data security. As we move toward digital solutions and cloud-based storage for medical images, ensuring data privacy and compliance with regulations such as HIPAA becomes more complex. Breaches in security could compromise sensitive patient information, making data encryption and secure storage solutions an absolute necessity. The radiology field has recognized the importance of addressing these challenges, and many institutions are now investing heavily in cybersecurity measures. However, the demand for better security protocols is only expected to grow as digital imaging continues to evolve. Finally, the role of radiologists is evolving. With technology handling more of the routine analysis, radiologists are stepping into more consultative and collaborative roles within healthcare teams. In fact, there's a growing expectation that radiologists participate directly in patient care, offering insights that go beyond what's seen in the images. This shift toward a more patient-centered approach aligns with the broader trend in medicine toward personalized care. As radiologists spend more time interacting with patients and clinicians, they become integral parts of the patient's healthcare journey. Helping to interpret complex imaging results in a way that is understandable and actionable. Looking ahead, it's clear that the future of radiology is promising, though it will require us to adapt continually. Whether we're talking about AI, radiomics, interventional procedures, or data security, the field is pushing forward at an unprecedented rate. Radiologists have the chance to lead in this space, embracing innovation and helping shape a future where imaging not only diagnoses, but also directs patient care. As technology advances, our role will undoubtedly expand, demanding a balance of technical expertise, patient-centered skills, and collaboration with broader medical teams. Thank you for your time today, and I'm excited to see where this journey takes us in the coming years.
That is the end of Part C. You now have 2 minutes to check your answers.